Welcome, everyone. We're going to give it a few minutes for everyone to log on here. Good afternoon, folks. We will get started in just a minute or two as we see folks logging in. Okay, we can go ahead and slowly start to get ourselves started here. My name is Annie Bruno. I am a Central and Southern Family Advocate with the Arc of Illinois. Um, we want to extend our thank you to Family Matters for this awesome collaboration we've been doing. We've got Megan Moody here on the call as well as Abby Mars. They're going to be kind of in the background today. And we just want to say thank you for our four-part series. Maybe we'll have to do it again. It's been wonderfully well attended. So thanks everyone else for being here. I want to mention two things, which is one, there's going to be a PD link for folks that need PD. That's going to be put in the chat. Um, Two, at one point there was some confusion about this got a reschedule thing from Zoom. We don't know how that happened. This is the last of the four. There is not another session after this. So we hope you have a wonderful fourth and final session with us, but don't show up next week. We won't be here. So, without further ado, I will slowly get us started. Just some quick housekeeping items. If you can please put questions in the Q&A box at the bottom, that's going to be really helpful because we have a big audience today and we anticipate getting questions. We welcome questions. We would love to answer those and we'll try to give ourselves some time to do so. But if you put them in the chat, they're going to be a little bit hard for us to find. So please put those in the Q&A box. As I mentioned, my name is Annie Bruno. I am a licensed clinical social worker as well as a qualified intellectual disabilities professional, or a Q by other names. I'm from Champaign-Urbana, and I share this screen just to kind of share you a bit about my background. I've been working in disability services for over a decade or so, and was in Best Buddies in college. And of course, I have to include my husband, obligatory photo of him. But really, we all know the showstoppers here are my two dogs, Lentil and Sprout. Just a little bit about me, and I have with me today my colleague Jerin, who's going to share about herself as well.
Thank you so much, Annie. So my name is Jerin, and like Annie, I am a family advocate with the Family Advocate Program at the Arc of Illinois for Central and Southern Illinois. But I also have a background in early childhood education, in family and community engagement and special education, and in public service. I serve as a village trustee in my local community. I am a Springfield area native. I am the proud parent of four children, including a child with a neurodevelopmental disability. And I advocate for inclusion and accessibility for all.
All right, thank you,
Thank you,
Jerin.
Annie.
So we're here today to talk about waiver services and the Arc of Illinois. We want to make sure that you become familiar with us and what we can offer. We'll talk very briefly about the PUNS process because we did that 2 weeks ago. We're going to mostly dive into the services today and share about some upcoming cool events. So the Arc of Illinois, if you are not familiar with us, we are one of many ARCs. We are a chapter of a nationwide grassroots movement. Our services here at the Arc of Illinois specifically are based on education, advocacy, connection, system navigation, information gathering. We don't do a lot of hands-on direct support, like we don't run group homes, for example, but the Arc of Illinois does provide education and outreach like we are here today. Here's a quick look at our programs. Jerin and I are from the Family Advocate Program, as mentioned, under the direction of Miss Shirley Perez, who also oversees the Family Support Network. But one of our big programs here is the Lifespan team. There's, I believe, 5 or 6 of those folks, and they are kind of your system navigation, research, and resource specialists. We call them like our general practitioners for system navigation through the state. So they're a great resource if you're looking for some information. I'm going to show you kind of some stuff on their part of our website. I'll also mention the Family to Family Health Information Center that's run by our colleague, Dr. Susan Agrawal, um, really specializing in specializing in 3 years old to 22. I almost said 0 to 3, which is actually the opposite. It's 3 to 22, with complex medical needs or medically fragile or technology dependent. She's a great guru for Medicaid, Medicare, insurance, generators, grants, nursing hours, all those kinds of things. We also work with some SODC, the State Operated Developmental Center advocacy and the institutional advocacy, as well as public policy, etc. So we've got a lot going on if you haven't been familiar with us yet. And as I mentioned, we're here from the Family Advocate Program, which specializes really in talking with folks as they navigate a pun selection. That is kind of our bread and butter. What we do all day, every day is we help folks navigate a pun selection. We are funded through the Illinois Department of Human Services, and we work side by side with the independent service coordination agencies to assist them as we assist families. And that's kind of just a fun picture of us with the director of the Division of Developmental Disability under the Department of Human Services at the state, and our fearless leader, Miss Shirley Perez. So we're going to quickly mention the Liggis consent decree if you are not aware. Back in 2005, Stanley Liggis, with the support of some other plaintiffs as well as Equip for Equality, they sued the state to kind of move to smaller community-based settings. Stanley was living in an ICFDD, which is an intermediate care facility. It's a bit of a larger arrangement. So he sought for community-based placement. And the important piece here is to know that we are still in a consent decree, and your loved one potentially could be a class member if they are over the age of 18, residing at home, needing and wanting community-based placement. So if you have an over 18-year-old who is enrolled on the PUNS wait list and qualifies clinically for these services, they may be a class member. That's important to know just because there's always kind of going ons with the consent decree and progress made, and the state has to kind of abide by certain criteria. So we just like to mention that here. We have a great Liggis fact sheet you can look at, as well as if you're interested in contacting Laura Miller with Equip for Equality, or any other documents, we've got those listed. And I should mention this, I was supposed to mention it up front and I forgot. Megan from Family Matters will be sending out all 4 weeks worth of our presentations next week sometime with recordings and handouts. So please know that you will get this. You will get links to stuff. We can't be putting in every link as we talk. You can look at it all later, but you will get it by the email that you registered with next week at some point. Okay. So just a quick perusal of our website. I wanted to just introduce you to some fun things. We had some teachers on the call last time. I just wanted to make sure that we reached out to all our different audiences. If you go to our main Arc of Illinois website, which is www.thearcofil.org, this is kind of our home screen, and it's probably changed since I put this up. But if you go under resources, you'll find our fact sheets. These are overseen by our Lifespan team, but they're just like such an invaluable resource. We got lots of great free information in many different languages that you can print and scan and save and send out and share on all sorts of topics. So I've highlighted a couple I thought may be applicable to this group, PUNS the Basics and the PUNS Pathway Flowchart. As you can see, we've got those in lots of different languages as well. But you can see we've got Medicaid, grief resources, SSI, SSDI. Um, these are all can be downloaded into PDFs and shared. So I would encourage you to do some fun looking around, um, especially if you're a transition specialist or someone working with those transition age students, or you have a transition aged loved one, roughly we say about 14 to 22 years old. Um, Lots of important moving parts at that age, guardianship and all these kind of benefit navigation, changing from an entitlement of the public school to eligibility for services and adult programming. So give this a perusal. I'm sure you will find something that is of help. Additionally, with our lifespan team, just to kind of shout them out, on their part of the website, you can also go in and search by a keyword like guardianship in Macon County. And it should pop up with some interesting resources. We've also got a resource toolbox. I just wanted to kind of introduce you to what we have available online. It's a treasure trove of different resources. And finally, our webinars are archived as well. So you'll see if you go under events that there's monthly webinars and there's archived webinars. We've got ours down there too, the Liggis Family Advocate webinars. These serve the gambit. It's managing assets. Let's talk about respite. There's how to prepare for the holidays, which can be hard. Lots of really great information, guardianship, Social Security, managing benefits, all those kinds of things. And if you, again, are connected to someone between the ages of 14 and 22 that has a disability, would highly encourage you to take a look around, because I'm sure you'll find something that's helpful. With that, I'm going to toss it over to Jerin, who's going to quickly brief us on that puns process and getting into services because we did that 2 weeks ago. You should be experts by now. Just kidding. But you should at least have some idea of how we got to where we are today, talking about waiver services.
Thank you so much, Annie. So yeah, we'll just kind of cruise through these real quick. This is a really great visual created by our team. It's called the Finding Your Way chart. It's kind of like your roadmap through that PUNS process. It starts with that initial contact with your independent service coordination agency to get enrolled on the PUNS wait list. And then you would update paperwork annually with your independent service coordination agency or your independent service coordinator. And then ultimately, your time begins accumulating after the age of 18 and you would receive what's called the early notification letter. That's a heads up that your loved one is likely to be included in that next PUN selection. And then when you receive that letter, you also receive a letter from us here at the ARC of Illinois. This is a good time to contact your independent service coordinator to see what, to begin planning for your services. And then you would receive what's called that PUN selection letter. This is your official invitation to apply for those DD waiver services. You'll begin, you'll work with your independent service coordinator to submit certain paperwork so that they can determine that clinical eligibility. Once an individual is found clinically eligible, then they begin what's called the personal plan process. This is really just an opportunity to look at the individual's goals and their needs and how the services and supports within this waiver can best support them. And you'll begin to build your plan. You'll choose which options you want to move forward with, begin to select your services and maybe your different providers. And once that's all completed, then your independent service coordinator puts that together in a packet and they submit it to the state for review. And once the state reviews it and approves it, you receive the third and final letter, the best one of all. That's your award letter and your services can begin. Next slide, please. So this is kind of another breakdown of that process by those three important letters. That first one, that's your early notification letter. This can come at any point, but oftentimes we see families receive these in December. This is a good time to apply for Medicaid. to prepare your documents for clinical eligibility. So things like your individualized education plans or IEPs, any kind of medical exams, your social security card, ID card, things of that nature. You want to contact your independent service coordinator or your ISC. Contact us here at the Family Advocate Program and really start to become familiar with the services that will be available once you get that PUN selection. You'll research service providers and things of that nature. That second letter, that's your PUN selection letter. This is your official invitation to apply for those waiver services. This typically comes about 6 to 7 months following that early notification letter. Usually we see those go out in the summertime. Again, you'll contact your independent service coordinator to begin that pre-admission screening process to start to work on that plan. Now, if you are currently receiving services and you're satisfied, say you're receiving services through another waiver program and you want to kind of stick there, you're satisfied with those services, um, your PUN selection letter does not expire. So you can choose to move forward with that selection when the time feels right for your family. Um, you would just still want to contact your independent service coordinator and let them know that you received the selection letter and what your plans are moving forward. If you choose to move forward with that PUN selection, you'd want to have your documents ready. You'll begin to participate in that discovery process. Your ISC will work with you to develop that person-centered plan. You'll, kind of pick and choose your services and select your providers. And once that's all finalized, again, your ISC is going to submit that packet to DHS for review. And then you receive that third and final letter, that best one of all, the award letter. This means that the state has reviewed your application and it is approved. Any services that you've chosen and your plan can begin from the effective date on that letter. Your independent service coordination agency is going to begin monitoring your case. They'll visit the home of the individual at least quarterly and as needed. And they'll also help assist the individual and families with changing or modifying any services or providers along the way. Next slide, please. So there is an opportunity to kind of bypass that wait time in instances where there is an emergency or a crisis. Um, if you are in an emergency or a crisis situation, you may be eligible to receive what's called crisis-based funding. Now, these cases are reviewed very meticulously, and they often involve outside entities such as, DCFS or maybe the police or APS. If an individual is pursuing a SILA placement or a community integrated living arrangement placement, the ISC agency is allowed to look statewide for those placements. To be evaluated for that crisis, like to meet that criteria for emergency or crisis, an individual must be experiencing or at imminent risk of experiencing abuse. And this could be harm done to the individual or potentially aggressive behaviors of the individual that could cause harm to others. Homelessness, such as living in a shelter, or neglect, where the individual is unable to complete those tasks necessary for living. Next slide, please. So now we're going to talk about your service options. So there are two key programs for adults with intellectual and developmental disabilities in Illinois. We're going to talk today about that home and community-based Medicaid waiver for adults with developmental disabilities. This is a Medicaid waiver. It requires that selection from the PUNS waiting list. There are two options that we're going to go over. There's what's called your home-based option or your community integrated living arrangement options. This program is overseen by the Division of Developmental Disabilities under the Department of Human Services, and it provides services wherever an individual lives. That could be in their family home, or maybe living independently in their own home or apartment, or maybe some form of affordable housing. But there is another option, and That's what's called an intermediate care facility for the developmentally disabled or an ICF-DD. Now, this is an entitlement, meaning that an individual doesn't have to be selected from a wait list, such as the PUNS wait list, to be eligible for this program. Some of these facilities do have wait lists based on their availability. Some of them are smaller. They might have 4 individuals, but the majority of them have 9 or more individuals. This program is licensed by the Illinois Department of Public Health, also paid for by Medicaid, but it is not one of those 9 Medicaid waivers. Next slide, please. So, as I said, there are 2 options within this waiver program. There's what's called home-based, and there's what's called community integrated living arrangements. Both of these provide supports and services um, for individuals with developmental and intellectual disabilities, and both can be provided in various home environments. But one of the core differences is really who manages the services. So in your home-based option, those supports and services are managed by the individual receiving the services, or their family. Whereas in your community integrated living arrangements, the supports and services are managed by a developmental disability provider agency. Next slide, please. So in that home-based option, the funding for this is fixed, meaning that everybody who is receiving those home-based services is receiving the same amount of funding each month to pay for their services. And the state kind of uses SSI as their guide point for funding for this program. And they set that at about 3 times the rate of that monthly SSI allotment, plus a 5% increase, and we'll talk a little bit more about that in one of the later slides. So the total monthly amount for that is $3,132 each month. Um, you kind of pick from a menu of services with those home-based services, and all of those services and supports must fit within that monthly budget, that $3,132 a month. The family and individual, as we said, is tasked with managing and coordinating those services. And some of the more popular services are personal support workers and community day service programs and self-direction assistance. And I'm actually going to pass it over to Annie, and she's going to talk a little bit more about that SILA option there.
Thank you, Jerin. So with SILA funding, it is not a fixed amount across the board. As Jerin mentioned, everyone in the state of Illinois gets the exact same amount of money when you're in home-based. In SILA programming, community integrated living arrangements, that's not exactly the case. It's calculated more on the individual's needs. However, you as a family, you're not really privy to that because that money is going straight to that disability provider agency that you have sort of handed over the reins and said, hey, please care for my loved one. So, by doing so, you've sort of asked that that agency be reimbursed. And so there's a couple different types of group homes. We're going to get into all of this in more detail. It is important to note that you can switch from one service to the other, but neither is easy to do. You know, it's paperwork and whatnot, but you do have that choice. So where can you use your waiver services? You can use them anywhere in the state of Illinois. We should specify because some folks think that this is a national program. It is not. The services are available within Illinois, but you can move within Illinois. So you can live in the family home. You'd probably have home based, or you can live in a group home, which would be SILA funding, and that's at most 8 total residents. It is important to know that you can only use one waiver at a time. So this doesn't work if your loved one has, let's say, DRS home services or the medically fragile technology dependent waiver that's operated through DSCC. You can only have the DDD services or one of the other waivers. So it's just important to note that. And so here's kind of your menu of service options. And I'm going to spend a minute on this slide so you can kind of absorb it. It is a little tricky to kind of visualize because some services are going to be available in home-based only. Um, so in home-based, as you are self-directing your services, you are allowed to hire your own personal support workers, and you are allowed to purchase a self-direction assistant who's going to help you. And we're going to talk about those, so don't feel like you have to know all that right now. But that's unique to home-based. But both in home-based and in Scylla are your services on the left side here. You get day programming, supported employment, you have options for behavioral counseling, some of these other services, home mods, vehicle modifications. We're going to talk about those in more detail. So we're going to highlight a number of these. But it's important to know that some overlap in Scylla and home-based, some are for home-based only. Either program, if you enter into this Medicaid waiver service, regardless, you are going to have what's called ISSA funding, Individual Service and Support Advocacy. That's coming from your same ISC agency that kept you updated on puns and helped you navigate through the service system. So once you're in the service system, they serve as kind of your monitoring body. Um, and it is both mandated for you to participate, but it also does not cost you anything to do so. It's kind of just this nice, neutral third-party entity that's overseeing your care. Um, and we've linked here the home-based consumer handbook. This is a nice written record of kind of how home-based works. So if you want to look at that in more detail, we welcome you to do so. Let's talk about PSWs, personal support workers. Your PSW is someone that your family knows and has chosen to hire to be reimbursed out of that bucket of money. That monthly allotment of 3132 for this year for the adult programming, you're having some of that money go towards reimbursing a worker. If you choose, this is all optional, but if you choose, you can have a worker. Your workers have to be over the age of 18, and they have to be able to pass a variety of background checks. But other than that, your workers can be mom and dad, grandma, grandpa, family friend, teacher from school, older adult sibling, aunt or uncle, can be whoever you pick and choose and trust. Um, you can have multiple workers as well. We would encourage you not to just have one. In the event that there's an emergency, you may be able to have someone else be available for backup. So if you have workers, it's nice to have a couple. They cannot be the spouse of the individual who is receiving services. So if the person who is in the waiver program is legally married, their spouse cannot be their worker. But other than that, it's pretty flexible. People like to have a variety of folks. You know, one worker comes Tuesdays from 12 to 2 reliably every Tuesday. But you can also have a worker on your payroll that bills once every 3 months when they come over for the weekend and they do whatever. So the other nice thing about your workers is that you can they can reimburse for the time they are spending supporting your loved one. But that can be time spent both at home or in the community. So let's say you go out to a movie on Friday night and the worker comes over to the home, gets the person, transports them to the movie theater, they go see the movie, they come back home. Your worker could get paid, the 4 hours of that shift, but this money is not going to pay for the movie ticket or the concessions. So this is reimbursable time to your worker who's supporting that person. Okay. A quick feature of Homebase 2 with your workers, if you have them, is what we call EVV, electronic visit verification. This is a newer statute from the Federal Centers of Medicaid Services. Essentially, it's kind of a clock in, clock out sort of system. So you would get an app. When you arrive at the house, you'd clock in. When you're done, you'd clock out. It populates your timesheet. It's a nice feature if you are a primary caregiver living with the person sharing the same roof. You can apply to be exempt for EVV, so that you don't have to clock in, clock out, and you can kind of just absorb those hours that are left over because you've already been with the person supporting them. So that's something to think about. And I will mention that Access has some EVV trainings coming up, I believe. So you may keep your eyes out for that if you're interested in learning more. Some updated budget information as well. Each year, typically there's a little bit of a switch in funding. And so in 2026, some of the costs to you went down. We're going to explain that. But they went down. But plus, the monthly allotment went up. So all things are pointing to this is good. This is great. Um, the monthly allotment is tied to the rate of SSI. It's just like a metric that the state uses. So for the adult waiver, it's 3 times the amount of SSI, monthly allotment. Uh, so that increased in 2026, but then they also decreased that cost to you. So long story short, the monthly allotment for the adults is that 3132 number. For children and young adults, it's a little bit different. It's 2 times SSI instead of 3. But we're not going to talk a lot about the children's waiver today. So let's kind of keep going on services, and then we'll give you a sample budget you can look at. But your self-direction assistant, or that service is called the assistance. Your SDA is typically someone who's employed by like a provider agency, a disability provider organization. I know some folks that kind of do it independently. Um, but an SDA is someone that you can pay out of your monthly bucket of money, your account of your 3132 can get paid a little bit for having someone help you navigate that budget. We highly encourage SDA to, when you're initially getting started, I like to think of it kind of as like an administrative assistant. They're going to be helping you understand how far your money goes, what's getting paid first, how much you're going to be paying your workers, and how does that equate to how much support you're going to get. They'll help you with timesheets. They'll help you with figuring out how to submit timesheets. Just a really nice service. And generally speaking, I think this is on our sample budget slide, but generally speaking, um, you're looking at like the state sets the rate of the billable hours for an SDA, and it's $54.59, I believe, this year, if I'm going off memory. And most agencies will bill anywhere from 2 to 4 hours a month. So again, you're looking at maybe at most $200 out of your 3132 can be paid to like help have someone help kind of hold your hand through the home-based budget part of things. So CDS programming, so let me go back. SDA services are only available in home-based because, and so are PSWs. If I go back, PSWs and your SDAs are only available in home-based because you're only self-directing in home-based. But available in both services is the day training, community day services. People used to call this developmental training or workshop, um, whatever the case may be. It's now called community day services. And this is a really nice program for kind of your folks that maybe want to keep that structured routine like school was. Typically, it's like 9 to 3, Monday through Friday. You can purchase all 5 days of the week, but you can purchase one day of the week. Every day program is going to have wildly different kind of activities based on everyone's support needs. Some examples I'll throw out are things like cooking class, exercise, arts and crafts, movies. Some people are out and about more, going to the library, going to the local YMCA. Locally to me, there's an agency here that has a contract where they go and they like clean a church once a week as a group. And so, a variety of different kind of things based on your loved one's support needs. It's a nice option if you want to purchase some of that time. Okay, with this, I'm going to turn it back over to Jaron, and this is where we'll kind of break down the costs for you.
Thank you so much, Annie. So, as we kind of learned, that you start with that budget, that starting budget of $3,132 each month. It's important to know that you really want to kind of maximize your budget because the unused amount does not carry over to the next month. It just kind of goes back to the state. So, we're starting with that $3,132. In this budget, we're going to utilize that self-direction assistant, that kind of like administrative assistant for your home-based services to help you kind of manage and coordinate those. We're going to utilize our self-direction assistant for 2 hours each month at that state set rate of $54.59 per hour. And so that's going to give us a monthly cost of about $109.18. So if we subtract that from our starting budget, that leaves us $3,022.82 left over. And in this budget, we're going to use that for personal support workers. So we have here our cost to you rate sheet. We use that to account for employer taxes. So, say for instance, we're going to pay our workers $18 an hour. We go over to that hourly rate wage of $18, and it actually ends up being about $18.36 when we account for those employer taxes hourly. So if we take that $18.36 and we divide that by our remaining budget of $3,022.82, that gives us about 164 and a half hours that we can use each month to pay for those personal support workers. Now, this is just a sample budget. Everybody's kind of budget can be unique. Maybe you want to use that community day services, or maybe you want to use just strictly personal support workers, and you don't need that support from a self-direction assistant. It will look different for everybody. This is just one sample of many different options. Next slide, please. So in that menu of options that Annie was talking about, um, some of the options there was what's called home and vehicle modifications, adaptive equipment, and assistive technology. Now, every 5 years, individuals who are enrolled in that home-based option or those home-based supports have access to this home and vehicle modification, adaptive equipment, and assistive technology budget that is actually separate from that monthly allotment of 3,000, that $3,132 each month. This is actually $15,000 every 5 years. This must benefit the individual with a disability directly and ensure their health, welfare, and safety. It must help to assist with community integration and address the needs specifically related to their developmental disability. Um, there are very strict requirements for what is allowable. So you would never really want to make any purchases until, this first has to go through your independent service coordinator for approval and then through DHS for approval. So you don't want to make any purchases until you have that approval. Some examples that, you could potentially use this budget for could include maybe adding a ramp to your home. Maybe getting a wheelchair lift installed in the family van, or a weighted blanket for those sensory supports, or a communication program for an iPad. If you'd like to learn more, we do have a link here with additional information. And you can also always reach out to your independent service coordinator for additional support with that as well. Next slide, please. So, in that community integrated living arrangements, one of the options in there is what's called a Scylla group home. Now, again, that community integrated living arrangement, this is not a fixed monthly budget. It's managed and coordinated by the Developmental Disability Provider Agency. And this provides that 24-hour a day, 7 day a week support. The provider takes care of the housing for the individual. They take care of meal preparation, transportation to maybe some community day services or some supported employment, maybe some community outings. They support individuals with their medications, administering their medications. They will make sure that individuals are able to get to their doctor's appointments. And they also maintain and care for, they have staff that maintain and care for the home as well. Next slide, please. So when you're considering a group home, you of course want to seek a home that would be a good fit for your loved one. You know, that's always that top priority. It's important to know that regional availability can vary significantly. Um, you know, you also you can inquire with your independent service coordinator regarding, you know, the average wait time for a solo group home for an individual with similar needs to your loved one and in your area. You'll want to consider the distance from your family home. Would you prefer for your loved one to live in a group home, you know, that is closer to your family home? Or are you comfortable maybe with some travel for a home that feels like the right fit? Would your loved one need a private room, or would they be comfortable having a roommate? These are all some really good questions that you can kind of consider as you're maybe exploring that Scylla group home option. Next slide, please. Another living arrangement in that community integrated living arrangement option is what's called intermittent hourly Scylla services. Now, this is where you know, individual would live in their independently in their own condo or apartment or home, and a direct support professional, which is an agency-based staff, would provide 15 to 20 hours per week of supports. Um, Now, if your loved one needed additional hours of support each week, you can work with your ISC and DDD to provide a higher level of hours based on each individual's specific needs. Good candidates for this option is somebody who can, you know, who is relatively independent and they don't need that 24-hour a day, 7 day a week support. Next slide, please. So another living arrangement in that Scylla option is what's called a host family Scylla services. Now, this is where an adult with a disability would live with a non-related individual, couple, or family. And that individual will receive all of the supports that they need from a host family. The host family, in turn, is receiving a stipend to be able to provide those supports based upon the needs of that individual. This is considered a long-term living arrangement. There are very extensive background screenings and a matching process that goes into place for this host family services. This is facilitated by a developmental disability provider agency, and that host family is a residential setting within a full-time residence of those paid caregivers, but the home itself can be owned, leased, or rented by either the individual who's receiving the services, a provider agency, or the host family themselves. The live-in paid caregivers or that host family, they will also arrange for relief and vacation staff on their own schedule, and those vacation staff are required to be direct support professionals. All right, I'm going to go ahead and pass it up to over to Annie, and she's going to talk about some upcoming events.
Thank you, Jerin. And I'll just mention too, I see we have quite a lot of questions and keep them coming. If we can't get to everyone, we will make ourselves available, don't worry. But some quick stuff about the ARC as we kind of wrap up. That was, you know, the nitty-gritty of services in a very brief time period. If you want to hear more, maybe your head's spinning a little bit, maybe you want to hear this again. We do twice a month webinars in English. We also do them twice a month in Spanish, which is my next slide here. But these are called our Know Your Options webinars. These are free. Great opportunity at two different times, two different days. If you are just interested in kind of hearing this again, it's a rotating staff of five of us where we're always kind of a different pair. So if you want to sign up for a couple, I would encourage you to kind of listen into these if you are navigating a pun selection and trying to figure out what your options are. It's a really nice program. And here it is in Spanish. As I said, we just added some evening dates. So if you have families that you know that are Spanish speaking, we have two Spanish speaking staff and they rotate doing these. Again, really nice opportunity to kind of hear about your options. And something outside of our scope that we're excited about doing, kind of new to us, are these listening sessions that the ARC is taking on. Our team of family advocates, is going to be hosting one next Wednesday night from 5:30 to 7:30. Our aim here is to mostly be with families who have recently been pun selected or early notified, but it is open to everyone if you're looking to join us. This will be a nice opportunity to give feedback on the state system and the intellectual and disabilities service system navigation. So you will have that information in your slides as well. Finally, if you were interested in EVV and having home-based, I would encourage you, if you at all can, make it to this event on March 4th. We've already done two. One was in Spanish, one was in English. This one will be in English. But it's really important stuff that you know how to do EVV and work with Access. We didn't even really talk about them today, but they're a big key player in home-based. So it would encourage you to look at attending that session as well. We've always got stuff going on, and if you visit our website, you can see all of our upcoming events. We are busy folks with a lot to do, so you're welcome to kind of peruse and catch something for when you're available. And with that, I will leave this slide on here for a second, and I will put into the chat our survey. If you're able to fill that out, that would be great. And other than that, we will get to some questions. Again, if we're unable to get to all your questions, we will make ourselves available. Don't you worry. Maybe Megan or Abby can put our emails in the chat. I am unable to put stuff in the chat. So if we're able to do that, that'd be great, as well as maybe that link I served up a little bit earlier. Okay, with that, let's get to some questions.
All right, Annie. It looks like our first one asks, does the consent decree apply to individuals seeking to live in a CLF, or is it only CILS?
It's a good question. And for folks that are unaware, it's a CLF is a community living facility, I believe, but there's not a lot in the state and there's none near me, so I'm not personally super familiar with those. Um, and I'm not sure if I know the answer to that question. I know that Ligus class members are those that are over 18, able to qualify clinically for these services. And the state has a record of them wanting community-based services, and so we say that record is being on puns. So in that sense, yes, the decree applies. But I do believe CLFs, community living facilities, are categorized a bit differently. And I don't want to speak to that because that's not my area of expertise.
Thank you so much, Annie. Let's see here. It looks like this individual was asking if there was a benefit to getting on puns earlier. So the individual said that they have a child who is 3. But if they won't officially be on the waiting list technically until after the age of 18, it seems like a lot of paperwork to stay qualified each year if there's really, no benefit of that being added earlier. And it says that their child is also currently, for background, on that MFTD waiver.
Okay, so we have a 3-year-old that's on the medically fragile technology dependent waiver. And the question is whether there's benefit to getting on puns. And my answer to that would be yes. In recent years, in the last maybe 15 years, there have been 2 surprise pun selections for children. And those children were under the age of 18. Well, that's a bit complicated. They were waiting on puns and they were in the seeking services category. They ended up picking a lot of folks that were like 18 to 22, but to enroll them in the children's waiver, and I don't want to confuse anyone, it depends on whether or not you're in school. Either way, there have been two surprise children's polls, and those were folks that were in seeking. And those folks got to have home based as a child in the family home so that you got some hours to pay for workers. Um, the other nice thing about it is that were you to want adult services in the future, once you get the children's waiver, you have a right to move to the adult waiver without having to re-wait on the wait list. So it's not automatic, it is paperwork that's required to switch, but it sets you up into adulthood. The other thing I would like to mention is that um, I know families have a lot going on. I get it. And I know that it can seem overwhelming. But the year to year requirement just to remain on puns is a pretty low lift. Um, you'd initially enroll, you'd meet with your ISC agency, you'd show proof of diagnosis and any other documentation that helped illustrate the picture that your loved one's qualifying and clinically eligible. And then from year to year, essentially, your ISC calls you and they say, "Hey, do you still want to wait on the PUNS wait list?" And you say yes. And they say, "Okay, great. I'm going to mail you some paperwork." And you sign about 6 or 7 sheets. It's like, I understand my rights, I consent, yada, yada, yada. And you mail that back. And that is typically the extent of a PUNS update. You can have that meeting in person. Often it's over the phone. And then typically, I mean, how I always did it, we mailed documents. So it, I would almost say it doesn't hurt. The other thing I would just mention is that if you are someone that's already in a waiver, so therefore your loved one already has pretty high needs, I do not think it hurts to start building that relationship early with your ISC, putting your name and your face on their radar. This is my family. These are our needs. Let's talk once a year. Let's touch base because if something emergency happens, um, you're familiar to them. And so I would recommend it if you have it in you to do it early.
Thank you so much, Annie. We had another question asked if a family was leaving Illinois to travel for, say, a couple of months, what would happen to the funds while, during those months when they are traveling? Would they just not utilize them? Is there, some kind of a time limit that an individual can spend outside of Illinois, but, they're still a resident of the state of Illinois?
Yeah, it's a good question, and I have like the answer on paper, I would tell you, and then there's also like logistically, I know families do this all the time, so I'm not going to advise one way or the other, but my understanding, and this is something again I would default to your ISC. What's their advice? What can they tell you about? I would hate to give you advice and have your services be in jeopardy. So ultimately, you need to speak with your ISC. But my understanding is that Illinois Medicaid begins to be in jeopardy if you are out of state for 30 consecutive days. And your Illinois Medicaid is what pays for these services. So that was always kind of our marker was don't go out of state for more than a month at a time. But again, I would default to your ISC for a finalized answer on that.
So much, Annie. This question asks if every case is individual according to an individual's needs, um, how do they know how much amount is assigned to the client in home-based services, considering our OCS do not provide reports, um, to know how
Yeah,
much the
I
provider is costing?
I
And the
saw this
employer
one,
is not going to be
Jaron.
prepared.
I think it's getting a little in the weeds. ROCKS is the name of the billing system that the ISCs use and that the other provider agencies use, I believe. So, okay, wait, I think I got it. I think I got it. I reread it. Um, I think what this person's asking is if you're in home based and you have that monthly allotment, how do you know how much the provider's billing each month into rocks because you don't get those reports. So I think that's what this is asking, and I guess I would say there's a couple things. If you don't already have an SDA, I would hire a self-direction assistant because they will make your lives easier with negotiating how much is going to the provider agency, how much is left over for you as a family. They will help you figure that out. And in fact, if your loved one, let's say, is going to day programming, oftentimes that agency may want you to use their SDA so that they can make sure as an agency that the day program is getting paid. Um, because everyone wants to get paid, right? So I would say utilize SDA. Um, and there are, like forms that you're going to be using that kind of say like, Kelly, our PSW, we've agreed that we'll pay her up to 15 hours a month. And so we're not going to be paying her 20 hours a month because her agreement has a maximum of 50. There's things like that that are in place. I've been out of that world for a little while, so I don't want to speak to exactly what the forms are. But I guess what I'm trying to say with this person is that if you're in home-based and you're not sure exactly how much the provider agencies are billing out of your plan, that's a good opportunity to have a meeting, request your ISC be there, and maybe look at getting an SDA just to kind of clarify that because no one wants to overbill and then have it be that your workers don't get paid. Okay. How about this one, Jaren? Just confirming a parent can be a legal guardian and also the personal support worker.
Yes, absolutely. Your personal support worker could be mom or dad, who could also be, their individual's legal guardian. Or as we said, an adult sibling,
The only
somebody unrelated.
situation where that's not cool is if the individual who's receiving services is under the age of 18. Then their legal guardian cannot be their worker. But as soon as the individual turns 18, even if the family goes to court and gets legal guardianship over that person, they can still be their worker. And that's unique because we don't talk about the children's waiver very often because it's not a big group of people.
Thank you. So, is the money for the PSW that the PSW received tax? Would the PSW get a W-2?
Yeah, we're not tax experts. We're not supposed to advise on that. It all depends kind of on how you enroll as your worker, and there's a stack of paperwork you'll have as a worker, and your relationship to that person. So we're not going to answer that, but I would encourage you to either ask your ISC or your SDA if you have one, because they can definitely give you some guidance on that. Also, you might explore Access's website. I think it's mycil.org if I'm remembering correctly, but Access Illinois is the fiscal agent. They kind of deal with all the enrolled workers and issue their checks and stuff. So they would certainly be able to answer that as well.
And they are linked in our presentation in that EBV feature, their website as well. So,
Yes.
and everybody will have access to that as well. Somebody asked if the Puns timeline visual aid, our Finding Your Way chart, is available to view on the ARC website. Absolutely. You would just go to the ARC and look under those fact sheets under our resources tab and, scroll
Yeah,
down
I
to
think
fact
it's
sheets.
it's like the puns pathway, I think is what it's called
Hmm.
there.
Yep. Another individual asked, how do they get in an ISC? Their son is 14.
Well, great age to start asking these questions. And maybe you were not at our first presentation, but your IC is like your best friend. So, uh, I'm trying to think if we have the office locator in our PowerPoint, but I don't know if we do. And I'm not able to put it in the chat, but you're welcome to reach out to us by email, or if you want to try to Google DHS office locator, Illinois. There's a drop-down menu. You'll put developmental disability services and you'll put what county you're in. It will spit out you like what ISC is assigned to your region, and you'll give them a call on their main phone line, and you'll say, "Hey, I have a 14-year-old. I want to get him enrolled on puns."
Thank you, Annie. We
What
had another
about
question.
Jared?
Oh, sorry, go ahead.
I was gonna toss one to you. Is it possible to choose not to utilize SDA if you have home-based once you get the track of things?
Yeah, absolutely. That self-direction assistance, that is an optional service. Some families like to utilize that service to have that extra support to help them, with their personal support workers and kind of navigating their services. But other families feel perfectly comfortable, managing and coordinating their own services. So that's an optional service. You can choose to use that or to not use that. Do you have anything to add to that, Annie?
Nope, that's exactly right. I was just gonna say we're at 1 o'clock, but we'll stay on for just 2 or 3 more minutes because I think we've only got a couple more questions. And we're gonna answer these couple and we'll make some final housekeeping goodbyes. Yes, these are gonna be recorded and you're gonna get slides and all of that is gonna be sent to your email next week. Okay, can home base cover the cost for a credit class in disability programs at college? No, that is not a covered service under this program. Sorry. Some things are not covered. Can you only access a group home, a CILA, community integrated living arrangement, if you have the DDD waiver? Um, I don't want to say yes to this, but I will say I've worked in my past with one person, one single person that was private pay for CILA, which is astronomically expensive, but she had um, what do you call it? Her dad was a retired professor or something at the university. She had a pension. I think she had access to a pension or something. So she was able to private pay. You still have to meet the eligibility clinical requirements. You still have to find a group home that's going to be able to serve you. All those things are still true. And frankly, I'm not even sure if your ISC does that if you're private pay. But 99.9% of cases, you're going to be getting the waiver programming and funding in order to access a CILA.
And
This person, oh, go
oh,
ahead.
go ahead. Oh, I was just going to say, I see a question here that asked if they can get the waiver for community day service for their son, as well as another waiver for PSW at the same time. Um, this waiver covers both of those services. So you absolutely, as a part of this waiver, could have both community day services for your son and a personal support worker at the same time. You remember you're kind of picking from that menu of services, what best supports the goals and the needs of your son. So maybe for him that looks like going to community day service a couple of days a week, and then the remainder of that time utilizing personal support worker. Um, so it can look different for everybody, but both of those are options within this or services within this waiver that you can utilize.
And both would be available in home-based. If you were living in a group home, you could do day programming, but you wouldn't be having any workers because you're handing over the reins to the agency to have their staff care for your loved one. Just thought I'd mention that. If my ch We'll take one more question we've got in here. If my child already is on the home-based waiver, do we have to wait until 22 to transfer to the adult programming, even if my child stays in the public school? So that's what's tricky about the children. It's called the children and young adult waiver versus the adult waiver. The the criteria for switching is at what point your child leaves school. If they leave school at 18, then you can switch to the adult waiver. If they choose to remain in the school district until 22, which is their right to do so, then you can switch to the adult waiver at 22. It's really a matter of kind of personal choice. And are they benefiting from staying in school? We'll keep them in there till 22 if they can. You're still getting extra support through the children's waiver. But if they're going to be done with school and that's absolutely not going to help, at 18, you could switch to the adult waiver and then begin accessing things like community day programming. Now, essentially, like that's built in if you're going to school. But if school isn't going to be an option or that relationship's not great and you want to pull them from school and have them graduate, at that point they can get moved to the adult waiver.
Thank you
Okay,
so much,
so
Amy.
a couple things to wrap up. I'm seeing we've got people that are leaving because that PD link is in there. So we're gonna wrap us up with just saying thank you so much for this excellent series. Everyone's going to get an email with all the recordings and all the PowerPoints and all the links. So look out for that and wait a couple days till mid late next week. And then if you can't find it, you can reach out. But let's give it a couple times. It's going to be a lot of information to kind of compile. Um, Remember to do your PD link and anything else. Fill out our survey. Do we want to put our survey in the chat again? Abby put that in the chat. What else? Abby, Megan, am I missing anything? We just want to say thank you so much for being here.
It was a great experience. As always, we learn lots when you guys present. I hope you learn lots from us as well. And it was great to meet some new parents and caregivers throughout the state as well as educators and professionals.
Thank you. Thanks for being here.
Thank you so much, everyone. Have a great rest of your Friday.
Thank you.